promised you some techniques from my work in EMDR that I find usable across the board for people working with any kind of trauma or difficult memory experience. I've been doing EMDR for 4 or 5 years now. I never went through the certification just because I didn't find it necessary, but I needed something in my toolbox so that I could work with trauma. If you've had me in class more than once, you know I like to talk about EMDR because I think it's terribly effective. I want to show you some of the preparatory techniques I use to give clients skills to handle difficult memories, to give them a way to bring that down a bit, do some grounding, and then I have 7 questions, hopefully you can see it all on my screen here, that before they reprocess a memory, to get them in the moment of that memory, I ask them and walk them through before they reprocess. So container and safe place are on my screen right now, and they are 2 that I use together. I want you to do this with me. The container and safe place are both cognitive structures. So get ready to go through this process. First, container. A container is a cognitive structure used to help store difficult, traumatic, or burdening memories that clients have to go through. It can be any kind of structure that does the following things. You can store those memories in it, lock it, put one memory in at a time and take one memory out. We're not storing people, we're storing memories. So think of what your container would look like, because you're probably saying, what in the world is he talking about? The container that you imagine can be anything from a box. I've had clients say a tree that folds up on itself, vending machines, safety deposit box, bank vault, a whole house. If you've ever listened to NF, he's a rapper from Michigan. He wrote a song called Mansion that has been helpful for some of my clients, because in the process of his rap song, what's the proper word for that? I don't know. He goes through all the different rooms and the things that happened to him in those rooms, and he doesn't want to go in the basement because that's where the abuse happened. It's a pretty significantly awesome song as far as dealing with his own trauma. You could use a house and store the memories in the different rooms and then be able to pull them out one at a time. So what I want you to do now is I want you to pause the video, and I want you to get to thinking about what you would have your container be. If you actually paused, then you're going to be starting up again here with me. The container then is going to store all your memories. Whatever you're picturing in your mind, I want you to picture all of your bad memories that are disturbing to you as a pile of dirty laundry. Here's a dirty shirt I have just for this. Imagine it's a bunch of laundry as opposed to the specific event. Think about them in a pile. And then I want you to take that pile and put it in your container. If it needs to be bigger, make it bigger. I had somebody do a car recently, and he said, the regular car's too small, I've got to make it a van. So he put all the memories in the van. He locked it and was able to walk away. Close your eyes, imagine this, and I'm going to have you pause it and do that exercise. So take the pile of dirty laundry, put it in the container, lock it, walk away, and then open your eyes. Okay, if you've unpaused now, I want you to notice how you feel. Did the ability to lock away all those difficult memories make you feel lighter? Did it make you feel better? About half my clients feel better at least the first time. We'll practice it several times in session. Now, the next thing I want you to do with the container is on a scale of 0 to 10, that is 0 is neutral, the memory doesn't bother me. 10, my hair is on fire, I can't stand it. Pull a memory out that's a 2, take it out of the container, feel it, notice where you feel it, put it back in the container, lock it away, notice how you feel. Now do it one more time. Unlock the container, pull out the 2, lock it up again, notice it, feel it, unlock the container, put it back, lock it up, notice the difference. Hopefully you felt something. A lot of clients will, especially if they're heavier memories, if they've always got this heavy weight on their shoulders. Some of you might have already worked through anything you have, or you don't have anything that heavy, and so it might not be as effective for you. So the next thing is safe place, connected to container. You'll do the container and then go to safe place. Safe place is another cognitive structure, usually outdoors. There should be no other people or pets around. No, there's never been a perfect relationship because we want you to feel completely safe there. It should be like your favorite place on earth. If you like the beach and you like to go to Lake Michigan or Florida to the coast of Texas to California, or if you like the woods or a river, those in Montana and Wyoming, trout streams, or whatever else we call them out there. We have those kind of things here too. You're going to imagine yourself at one of those places. So now if you'll do this with me, close your eyes, notice your surroundings. You're going to that place. For me, it'd be the beach on Lake Michigan. I would notice the sand under my feet. I would notice where the sun is in the sky. I would feel the breeze. I would smell the smells, because it's a big enough lake, you don't get the stinky stuff. I would walk around and notice, relax, and at one point sit down and do all the different things. Take 5-6 minutes. Assuming that you've done the container, here's what I want to do. I want to put those two things together. This is a whole session. I want you to take that 2 out of the container, feel it, notice the discomfort, put it back, lock it, notice if you feel any lighter, and then go to your safe place. If it was really effective for you, I hope that you spent a while in the safe place, just relaxing and calming. Now, there's another technique that we will use with EMDR, that if you have somebody that has a memory so difficult they can't talk about it, you can use something called the flash technique. The flash technique involves blinking and the tapping of your legs that mimics the bilateral stimulation. You don't have to do it as hard as me, especially in session. I was just trying to get you so you could hear it. Say somebody witnessed a murder, or they were violently and sexually abused. It puts them in a fetal position. It's a 9 out of 10, it's a 10 out of 10 on the 0 to 10 scale. 0 means neutral, 10 means hair on fire. The higher the number, the worse the memory is for you as you sit there now and remember. When it's too high that a client can't get there, I will often use what's called the flash technique. So practice this tapping first on a good steady pace. Not too fast, not too slow. Now, you as the counselor will say to the client as they're tapping, flash, and they will blink their eye 3 times as they're doing the warm-up. When you finish that set, that's the warm-up, they will blink their eyes 5 times. It feels silly, but if they can take it seriously, and so can you, then it can be effective. I've seen people go from 9 to 6 to 5 to 4 just because of this. For whatever reason, it allows the brain to free up and not react as strongly. It's the bilateral stimulation, and the flashing is almost like super fast eye movement that helps with the reprocessing. There's a lot of research that shows it as effective. I've seen it to be really effective in session. It always helps. Exactly. The flash technique is this. I want you to think of that memory. If it were a client, you would say, I want you to think of the memory. I do not want you to describe it. I do not want you to get into gruesome details. I just want you to notice that it's there. They notice that it's there. And while they're noticing it, you have them start tapping. And you say flash, they blink 3 times as fast as they can. So I'm going to do this with you. Ready? Start tapping your legs. Flash, blink 3 times. Flash. 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 Notice I did it 5 times. 1, 2, 3, 4, 5. Actually, you can do up to 5 or 6 sets of this if you want to. But when you get into full sets, they're going to blink 5 times, and you're going to do it 5 times. So let's do that here. Start tapping. Match my pace if you can hear it. Flash. 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 Now you can do that several more times, but each time you do it with them, check in 0 to 10, where do you feel right now as you remember that memory? And usually it comes down a little bit at a time. And you can do it several times over and over again. You can take 15 minutes with that and just try to get that down. Okay, so you have container, you have safe place, you have flash technique. Now, 7 questions I think can be used in other situations as well. Before somebody's going to reprocess a memory, whether using the tappers or you're doing your hand like this, I walk people through these 7 questions because it gets people prepped for the memory, meaning it brings it up, they feel it, they notice it, they're thinking about it. It makes it easier to get through that memory that way. So, question number 1 was, what is the worst part of the memory? Now, this can be emotion, but it also can be just a practical thing that happened. What emotions are you feeling? It could be one or multiple as you think about memory. Oftentimes I get things like grief, pain, shame, sorrow, undeserving, all of that kind of stuff. They're not necessarily even emotion words all the time, but they are directly tied to an emotion, so you help them define what that is. And so where do you feel it in your body? I've noticed most of the time that guys feel whatever it is in their chest and shoulders, ladies, shoulders and stomach. It's not universal, but commonly that's what I've seen. Okay? And then what negative cognition would you have about yourself as you remember the memory? This is the idea within cognitive behavioral therapy. We have something called negative cognitions, or they would say automatic thoughts in cognitive behavioral therapy. That is how we preach to ourselves all the time. When they're remembering this memory, they're thinking negative things about themselves. Because it was a terrible thing, more often than not, they feel responsible for it to some degree. Or they feel like it was their fault, or they feel like they could have stopped it. And they give me this, I'm not worthy, it's my fault, I should have done something, I was weak. All of that kind of stuff comes up. And then we say, okay, what would you rather have been thinking? And they might say just the opposite of what they said. I'm not weak. I'm strong. I am worthy. That's what they want to be thinking. So back to the particular memory with the negative cognition then, from 1 to 7, 1 being completely false and 7 being completely true, how true does that you are not worthy feel right now as you sit in the chair and remember the memory? And they'll say something like 3, 4, 5. You say, okay, then how disturbing is the memory to you right now? And remember, you have the mild, like 0 to 3, the moderate to 4, 5, 6, the more severe to 7, 8, 9, 10. And if they're at a 9, 10, you might want to do that flash technique. And so this stuff can set up any kind of trauma work that you do with people, whether you're doing EMDR or not. You can do this with trauma-focused CBT. You can do it in cognitive processing of traumatic memory.